Hello everyone, welcome back to another lecture. So in this lecture, we're going to be looking at articulations. And so when we say articulations, what we're talking about is we're talking about the joints of the body. So the previous lectures, we've discussed the skeletal system in general, some skeletal physiology. We talked about the axial skeleton. We also talked about the appendicular skeleton. And so with this lecture, with articulations, what we're going to do is we're going to build on our knowledge of the axial skeleton, build on our knowledge of the appendicular skeleton, and how these come together to form what we'll call joints or an articulation, right? So if we use the term joint, if we use the term articulation, those are different words meaning the same thing, all right? So to begin, when talking about joints, it's important that we get a common misconception out of the way. And this is the misconception of being double jointed, right? So let me ask you, does double jointedness, somebody who is double jointed, does this really exist? Is this an actual thing? So when we say double jointed, we're talking about people who can do things like this. They may be able to move their thumb like this, or they can do whatever the hell this is with their thumbs here, all right? So do you have a true double joint, right? So this is implying you have one joint on one side of the finger of a region, and then on the opposite side you have a mirrored joint, right? So does this exist? No, this doesn't exist. What this is something called joint hypermobility. So essentially the collagen fibers and the connective tissue that surround a particular joint, so whether this is a finger, this is a wrist, an elbow, a hip, a knee, a shoulder, whatever it may be, they just have a greater degree of mobility, greater flexibility, but there's not a double joint. There's not two joints where there's normally one. It's just that their joints are slightly more flexible, slightly more mobile than other individuals. Okay. All right. So also answer this question. So what is the relationship between the mobility of a joint? So how much movement can occur at a joint, and that same joint stability? So how stable it is. So what's the relationship between the mobility of a joint and the stability of a joint? So pause it, try to answer the question, and I'll move on. So what the answer is that they're inversely related, right? So in other words, as one goes up, one increases, the other one's going to decrease. So as we increase the mobility of a joint, how much movement we can produce, by virtue of being more mobile, we're going to decrease the stability of the joint. So we're going to be more likely to have some type of disarticulation, some type of dislocation, right? So if we look at this graph, you can see this very clearly. So as we increase in stability, as we go up in stability here, we are going down in mobility. And then likewise, as we increase in mobility, we are decreasing in stability. So we'll talk about these specific joints, all these here. So the suture joints, or these sutures of our skull that join adjacent skull bones, are essentially immovable. We cannot move them at all. They're what are called a synarthrotic joint that we'll talk about. Because of this, because of their lack of mobility, their lack of the ability to move, they're very stable. So you're not likely anytime soon to somehow dislocate or disarticulate the bones of your skull. Okay, that's not going to happen. Likewise, if we have a very mobile joint, something like the shoulder, because it's very mobile, because it allows the joint capsule here in this specific type of joint allows it to move around a lot, by virtue of it moving a lot, it's inherently going to be less stable. And then you can find joints that are all in between these two ranges, all right? So this is this third point down here, stability versus mobility. They're inversely related. As one goes up, the other goes down, all right? Degrees of freedom. All right, let me start up here, range of motion. So range of motion, this is just a very general term referring to how mobile is a specific joint, all right? You can use a device called a goniometer, which is this plastic device you see up here, that can be placed along a particular joint. So in this case, it's the tibiofemoral joint, so the knee joint. And then the patient or the individual can move that joint, they can extend it, they can flex it. And a therapist or a physician or whoever's doing this can assess their range of motion. So how many degrees are they able to move a particular joint, right? And then degrees of freedom is referring to the number of axes around a joint, around which a joint can move, all right? So in other words, can you move your joint in just one set of directions? So in other words, flexion and extension. Can you move it in two? So flexion, extension, and then abduction and adduction. Or can you move it in three, which you'd have flexion, extension, abduction, adduction, and then what's called rotation, right? So we'll talk about uniaxial joints, biaxial joints, multi-axial joints, and then one called non-axial. And all of these have a different number of degrees of freedom. So how many degrees or how many planes or axes can you move that joint around? So think of your elbow. You can only move your elbow in one set of directions. You can extend it and you can flex it, right? But if you think of your shoulder, you can move your shoulder in many more directions than you can your elbow. So your shoulder has more degrees of freedom than your elbow does, all right? So moving on, we're going to look at joints in two ways, all right? We're going to look at them structurally and we're going to look at them functionally. So what we'll look at first is what's called the functional classification of joints, right? So when we look at the functional classification, we're talking about the amount of movement that can be performed at a particular joint, right? So in general, we're saying that the joint can move a lot, the joint can move a little, or the joint does not move at all, right? So if we take this last one, a joint that does not move at all, an immobile joint, this is called a synarthrotic joint, or these are synarthroses, right? So a good example of this are the bones of the skull, right? Or the joints of the skull, those sutures, okay? If your joint can move a little bit, but usually really not even enough for you to notice, it is called an amphiarthrotic joint. Okay, so you have some degree of movement. It can move a little, but typically not enough for you to notice. So if you think of the joints of your tibia and your fibula, so the proximal tibiofibular and the distal tibiofibular, these are a type of fibrous joint that we'll talk about in a second, and they're amphiarthrotic, meaning they have some ability to move, but the degree to which they move is really not to the point where you can even notice it, right? But there is a little bit. And then lastly, if a joint moves a lot, and this is typically a lot in the sense that you can actually see your joints moving and you can, physically move them, then these are called diarthrotic joint, or they are diarthroses, okay? So these are freely mobile, freely movable, and most of our synovial joints, if not all of our synovial joints, are of the diarthrotic functional classification, right? So the good thing about articulations and the good thing about being able to understand these functional classifications is you have joints readily available to you, right? You have joints very superficial, you can move them around for yourself. So if you ever get confused, if you're ever unsure about, oh, I can't remember if this joint is synarthrotic, amphiarthrotic, diarthrotic, try to move it yourself. If you can move it and you can tell, then it's diarthrotic. If you know for sure it can't move, so namely the sutures of the skull that we see here, that's an example of synarthrotic. And then if it moves a little bit, but not enough for you to notice, like some of the joints on our upper limb and lower limb, then that's amphiarthrotic, right? So this chart will be a good, if I can go to the next slide, this chart here will be a very good reference for you, all right? So, if you see in this fourth column here, this is movement. This is describing the functional classification, right? So they're either diarthrotic, no movement, amphiarthrotic, slight movement, or they are diarthrotic, free movement. All right. So as you see, synovial joints, these are all diarthrotic, and then fibrous and cartilaginous that we'll talk about are either synarthrotic or amphiarthrotic, right? So you'll find patterns and you'll find common characteristics between joints in a particular category, all right? So as you see here, you see these dark green rows right here. These are describing the structural classifications, the general structural classification, which are fibrous, cartilaginous, and synovial. We'll talk about these specific types of structural classifications later on in the lecture, but just know that for now, this will be a very good chart for you to begin to look at and begin to commit to memory, all right? So what we'll kind of progress into talking about is our various types of movements at specific joints. So before we talk about the structure of joints, we'll just talk about general movements that we can expect to find at different types of joints, right? But to first understand the direction of movement, so which direction does our arm go in extension and what direction does our leg go in flexion, we have to understand how our limbs get to the position that we recognize them in right now, all right? So during embryological development, we start off as this little kind of creepy, freaky, alien-looking structure that you see here on the left, and we have what are called limb buds. So we don't have limbs in the sense of how we picture them now. We have what are called limb buds, and these ultimately develop into limbs. And so what you see here, you see these little paddles here, okay? So these two superior ones are destined to become the arms. These two bottom ones down here are destined to become the legs, and the feet. All right. So what you have is you have these limb buds, both the two superior for the arms and the two superior, that'll be the legs, projecting out laterally from the trunk of the body. So here's the trunk, right? So here's the head, here would be the tail region down here. Here is our trunk right here, right? So you see the two upper ones coming off laterally, two lower ones coming off laterally as well. Originally, they're all facing anterior, right? So we're at the anterior, we're seeing the anterior surface of this embryo in this fetus. What you see here is the anterior aspect of what will be the upper limb and the anterior aspect of what will be the lower limb. During what's called limb rotation, you have the movement and the rotation of these limb buds to what will be their ultimate position, right? So the upper extremities, or what will become the upper extremities, the upper limbs, rotate laterally. So if you see this image in the middle, you see these arrows are pointing out laterally. The arms are rotating, or the limb buds are rotating laterally. So this is why in anatomical position, when we put our hands to our side, the palm is facing forward, okay? However, the lower limb, or these lower limb buds, rotate medially. So they face posterior, right? And so what this results in is it results in flexor and extensor compartments, along with the muscles and the direction that we produce certain movements. They're on opposite sides, right? So the anterior aspect of our arm, or of our upper limb, that's the flexor compartment. For the upper limb, it's the anterior. For the lower limb, it's the posterior, okay? Whenever we flex our elbow, we flex it coming forward, right? Our arm comes forward. But whenever we flex our knee, the lower leg goes backwards, right? It goes behind us. The reason for this, these same movements, but they occur in different directions, is because of this idea of limb rotation during development. And then because of the limb rotation, we get differences in the direction of joint movements. And then you also get differences in the positioning of muscles. So whenever we talk about muscles later on, we'll see that the flexor muscles for the upper limb are on a different part of the body than the flexor muscles for the lower limb, okay? So we will stop here with part one, and we'll pick up with part two by talking about specific types of movement, specific joint movements that occur at different joints.